Welcome! This presentation will cover strategies for bladder control with the goal of achieving restful nights and an improved quality of life for those affected by frequent nighttime urination. In this introduction, we will begin our discussion by addressing the condition known as nocturia and exploring its wider impact on an individual's health and daily life. To begin, let's establish a clear understanding of nocturia. By definition, it is the condition of frequent nighttime urination that disrupts normal sleep patterns. Its prevalence is significant, affecting a large portion of the adult population, and its frequency increases with age. The key symptom that defines nocturia is the need to wake up 2 or more times during the night for the specific purpose of urinating. The impact of nocturia on health and well-being is substantial. First, the constant sleep disruption leads to fragmented sleep and can result in chronic fatigue. This, in turn, leads to reduced productivity, as daytime drowsiness impairs both concentration and performance. Consequently, an individual's overall quality of life is significantly diminished. Furthermore, there is an increased risk of falls, a particular concern for older adults, during these necessary nighttime trips to the bathroom. Having understood the impact, we will now shift our focus to exploring the root causes. It is crucial to identify the various factors that contribute to nighttime urination in order to manage it effectively. Several common physiological factors contribute to this condition. The natural aging process brings changes in bladder capacity and kidney function. Certain medical conditions, such as diabetes, heart failure, and sleep apnea, are also closely associated with nocturia. Additionally, medication side effects, particularly from diuretics, can increase urine production. Finally, conditions that cause bladder irritation, like urinary tract infections or an overactive bladder, are also a primary cause. Beyond physiology, lifestyle and behavioral influences play a significant role. Fluid intake habits, such as consuming large volumes of liquids before bedtime, are a major factor. Evening beverages containing caffeine or alcohol act as diuretics and can exacerbate the issue. Dietary choices, including spicy foods and artificial sweeteners, can irritate the bladder. A sedentary lifestyle may contribute to fluid retention, and finally, a poor sleep environment or hygiene can worsen the cycle of nocturnal awakenings. We will now explore holistic approaches to bladder health. The following section will detail the implementation of effective strategies designed to help you achieve better, more restorative sleep. Strategic lifestyle adjustments can be highly effective. Implementing timed fluid restriction by limiting intake several hours before sleep is a primary strategy. Optimizing your evening routine with a relaxing ritual can improve overall sleep quality. It is also beneficial to maintain a regular daytime voiding schedule. Furthermore, elevating your legs in the afternoon can help reduce the fluid accumulation in your lower extremities that occurs throughout the day. Finally, let's discuss dietary considerations and bladder irritants. It is important to identify personal triggers by recognizing and avoiding specific foods and drinks that irritate the bladder. A key step is to reduce caffeine intake from sources like coffee and soda, especially in the evening. Similarly, you should limit alcohol, as it is a known diuretic. Supporting these habits with a balanced diet focused on whole, unprocessed foods will promote overall urinary health. To summarize our discussion on achieving restful nights, a proactive and multifaceted approach to bladder health is key. This involves implementing sustainable lifestyle and dietary changes to form consistent, healthy habits. Collaborating with healthcare professionals for professional guidance is crucial for achieving optimal and lasting results. By taking these steps, you can achieve empowered living, regaining control over your sleep, and significantly enhancing your daily vitality and overall well-being. Thank you. Have you ever found yourself in a frustrating cycle? Waking up night after night, your precious rest constantly interrupted. It's time to reclaim your nights. We're here to talk about ending that disruptive cycle of nighttime waking for good and rediscovering what it feels like to have a truly deep and restorative sleep. The culprit behind this widespread issue often goes unnamed, a silent thief that steals our sleep and energy. Let's pull back the curtain and gain a clear understanding of nocturia's profound impact on our lives. It's more than just an inconvenience, it's a critical aspect of our overall health that deserves our full attention. So, what exactly is nocturia? In simple terms, it's the frequent need to urinate during our sleeping hours which disrupts our rest. While it's a very common condition affecting many adults, it's often overlooked. The impact, however, is significant, leading to fragmented sleep, daytime fatigue, a reduced quality of life, and even safety concerns from being up in the dark. To solve this, we must first unmask the causes. It could be related to your fluid intake, like having excessive consumption in the evening, especially of caffeinated or alcoholic beverages. Sometimes, it's about bladder capacity, which can be affected by age-related changes, weakened pelvic floor muscles, or overactive bladder syndrome. Furthermore, underlying medical conditions like diabetes, heart failure, or sleep apnea can contribute. Finally, the side effects from certain drugs, such as diuretics, can increase urine production. Now that we understand the problem, let's focus on the solution. Think of this next section as your personal blueprint for achieving better bladder control. We're going to walk through a series of practical, actionable strategies designed to help you win back your nights and enjoy the restful sleep you deserve. Our journey begins with smart sips for sound sleep. It starts with fluid timing. Make a conscious effort to limit your fluid intake 2 to 3 hours before bedtime. Instead, you should prioritize your hydration needs earlier in the day. A key tactic is to avoid diuretics, so try to reduce or eliminate caffeine and alcohol in the late afternoon and evening to set yourself up for an uninterrupted night. Next, it's time to do some dietary detective work. Be on the lookout for common bladder irritants like spicy dishes, acidic fruits, and artificial sweeteners, and try to limit them. It's also wise to reduce your sodium intake, as high-salt foods can cause the body to minimize fluid retention. The goal is to incorporate a balanced diet, which supports overall urinary tract health and helps keep things calm through the night. Let's take a closer look at the relationship between your meds and your bedtime. If you are taking diuretics, it's worth discussing prescription timing with your doctor to see if adjusting the schedule could help. You should also consult a healthcare professional for a full drug review, as other medications might be contributing to your nocturia. Remember, it is absolutely crucial to always seek expert guidance before making any changes to your prescribed medications. Beyond diet and medication, you can actively begin training your bladder. One effective method is scheduled voiding, where you gradually increase the time between your daytime bathroom visits. You can also strengthen your pelvic floor muscles through Kegel exercises, which gives you improved bladder control. Over time, using these gentle techniques of progressive delay can help you extend your bladder's holding capacity. Finally, we need to look beyond the bladder, as nocturia is often a signal of a larger health story. For instance, sleep apnea can lead to increased nighttime urination, so addressing those breathing issues is key. Effective diabetes management is also critical, as maintaining controlled blood sugar levels helps reduce excessive thirst. And managing cardiovascular health can minimize the fluid retention that often manifests as nocturia. It's all connected. So when is it the right time to talk to your doctor? It's a question many of us face. If you find that self-management strategies aren't bringing significant improvement for your nocturia, that's a key sign. Also, if you experience a sudden onset of new symptoms or a worsening of your nighttime urination, it's important to pay attention. This could be your body signaling a more serious underlying health concern. The best course of action is to seek professional medical advice to get a personalized diagnosis and a treatment plan tailored specifically to you. Think of this as your personal journey to undisturbed sleep. It's all about empowering your own path to wellness and reclaiming your nights for the rest they're meant for. Let's walk through the key steps for achieving calmer nights. It begins with something simple: evening fluid control. Being mindful of your intake, especially as bedtime approaches, can make a world of difference. Next is dietary awareness, learning to recognize and limit foods and drinks that might irritate your bladder. It's also crucial to proactively manage any underlying health conditions you may have. And remember, if issues persist, never hesitate to seek professional guidance. You don't have to figure it all out on your own. It's time to embrace restful sleep. This is about empowerment, taking charge of your nighttime awakenings by making informed choices. It's also about consistency. Remember that a series of small, consistent changes is the secret to yielding significant, lasting results. By investing in your sleep, you are truly investing in your overall well-being, paving the way for a healthier and much more vibrant life.